Hello everyone, welcome back to Olympia ThinkTank, Rewards of Knowledge. So I'm so delighted to have all of you with us today. So as we explore today's topic, which is the future of healthcare collaboration. So for today, joining us is our distinguished guest, Professor Selvin. Prof, thank you for coming and joining us today. Can you
Thank,
please introduce
thank you.
yourself first?
Thank you so much for having invited me to this platform with Olympia Education. I'm privileged, and hopefully, with our collaboration, we can bring better knowledge and insight into the futuristic health. Thank
Yeah,
you.
yeah, Prof. It's a pleasure to have you on the Olympia Think Tank podcast. Okay, Prof. So without further ado, let's shoot to our first question. So our topic for today is the future of healthcare is collaboration. When we think about the healthcare today, one question comes to mind. Why are chronic disease increasing despite all the incredible advance in medicine?
Okay, that's a question that would probably need a few days to answer, but let me try and get things straight. We are having one of the best healthcare systems in the world. In fact, we have been acknowledged as having a very good healthcare system. And let's go back a bit and say there's nothing wrong with the system. We have a very good conventional healthcare. When I say conventional healthcare, we have so many different types of healthcare coming in now. We have conventional medicine, we have functional medicine, we have integrative medicine, and complementary medicine. So they are diversified in their approaches. Now, there is nothing wrong with the conventional treatment. In fact, I think we have evolved from basic care to antibiotics to surgical, and now we can go to the point of cellular treatment. So, conventional healthcare is very, very advanced. It is very good. But what I'm trying to say here is we also then have functional medicine. And functional medicine says that we will not just look at the symptoms, we go towards the root cause of illnesses. And that's the difference between conventional medicine and functional medicine. Again, functional medicine doesn't displace conventional medicine. Now, the question people always ask is what is integrative medicine or integrative health? I prefer to use the term integrative health and not medicine because integrative health brings everybody together. That is, the conventional medicine, the functional medicine, integrative medicine, and complementary medicine. So, what we're trying to do is we are trying to bring a health service into place where the patient gets the best. So it is patient centered and it is tailor made to what the patient actually needs. For example, a patient may need, say, a hypertensive medicine because his blood pressure is very high, but he will also need to address his life changes, lifestyles. For example, he may need to go for exercise, he may need physio, he may need to look at his diet, he may need to look at his sleep hours. So there are many components that can actually enhance the conventional treatment. And when that happens, the amount of medication that he is going to take may be lesser than what he is taking now. Because what you see now is somebody goes in for hypertension, they start with, say, 50 milligrams of something, and after 2 months, he goes to 100 milligrams, 200 milligrams, and it keeps going up and up and up. And sometimes they need a second or a third drug. So, very often you will see somebody with hypertension with 3 different kinds of medication. Hopefully, with integrative healthcare, we can reduce that. We can make lifestyle changes and we bring about better quality. I think that's what integrative health is all about.
I see. Thank you so much. Very impressive. Just like I feel like I'm following in a medical school just now. Okay, Prof. For the question, healthcare has advanced tremendously over the years. Yet, why do we still have more people suffering from chronic disease like diabetes and even cancer?
Well, this is goes back to my first answer. In the years gone by, people had a more sedentary, I wouldn't say sedentary, a more kind of balanced lifestyle. There was a lot of walking, they were careful about food, there was less pollution, there were a lot of other things that were in control. In today's fast developing world, there are many parameters to consider. First is the genetical, what a person is predisposed to. Then comes the environment, what kind of lifestyle they have, the amount of pollution, the food they take. Majority of people are now taking fast food because they don't have time to make the food in their homes. So food is not natural in many ways. So it's not a single component that brings about an illness. There are multivarious components. And this is where, once again, I like to stress, where integrative health is going to focus on the different aspects of the disease formation. So if you're asking me, why has the incidence of illness gone up? There are many ways to look at it. The population has gone up, so the number of diabetics, for example, in a small population, you may get 5 people. In a population of 20, you get 5 people. But when the population goes up to 500, you will expect an exponential increase in the numbers. So suddenly you're looking at X number of patients and you suddenly think, why are there so many diabetics? But that is because the numbers have increased. Number 3, of course, lifestyles have changed. People ate organic food and a healthy kind of food. They had good lifestyle. They walk to work. Today, just to go to the market, which is about 100 yards, they either need a motorbike or they need a car.
Okay.
Nobody walks 100 yards anymore. So lifestyle has changed. Food has changed. Genetics have been affected by a lot of factors. I think this is where integrative medicine is going to make an impact.
Yeah, you see. Prof, so some people may think integrative healthcare means alternative medicine. Is that true?
This is again another sensitive question.
Oh, sensitive question.
It's
Is
a
it?
very sensitive question.
Wow.
Whenever we say integrative medicine, a lot of conventional doctors, even doctors, think, hey, that's got nothing to do with us, man. That's more on herbals. No. Alternative medicine replaces conventional medicine in the sense that they will most probably tell you, don't take the medicine that's given by a conventional doctor. You take this herb, you do this exercise, then your problem will be solved. That is a replacement of conventional medicine.
Okay.
When you say integrative, we will usually tell the client or patient, take the medicine the doctor has given you. But maybe if you did some exercise, your blood pressure may be easier to handle. And if you look into your food and diet, it may help you have a better blood pressure. So you may not need that second drug to take. So this is the difference between integrative care and alternative care.
I see.
Alternative care may replace conventional care. May
Okay,
replace
may.
conventional care or advocate replacement of that means you don't take the medicine, you take these herbs, you'll be better. Integrative care will say, take the medicine your doctor has given, but you can do the other things, the following things, that may prevent a worsening of the situation and an earlier improvement to your illness.
I see. So this is probably the biggest misconception in medical.
Absolutely. I mean, the myth doesn't just rest with ordinary people. It also rests amongst doctors.
Oh.
For example, I was speaking to a German doctor this morning, and he was very keen to come to one of our conferences. But then when he looked at the title of the conference, Integrative Healthcare, he asked me whether integrative healthcare means it's only the alternative medicine doctors are going to be there. And I had to explain to him over 10 minutes what it was all about. So
I see.
you're not alone.
Okay, I'm not alone. Okay, Prof. So we can see here there is a MIHA, Malaysian Integrative Health Association, at your back. Banting, can you explain to me what is MIHA? MIHA or MIHA? Should we
Right.
pronounce it?
I don't have to look at the back to explain. So, Malaysian Integrative Health Association. I mean, I've been in this country for many years, and I find the Dental Association, the Medical Association, and then private practice. There's so many associations,
Yeah.
and the majority of them will have that particular specialty people or that group. Like for dental, it's only dentists there, right? For medical, there are only doctors there.
Okay.
And for nurses, there are only nurses there. So it becomes like a political party because, in my opinion, a health team is where everybody works together. Where I trained in England, we have this board rounds meeting. We have representatives from every service there in the grand ward rounds because we want to see what is best and who needs to do what for this particular patient. For example, if I have a patient who needs dental health care, I need not refer and wait for the reply from the dentist. If there's a dental representative there, they'll say, okay, we can do this, this, this. The result is arrived very quickly. In the same way, I thought if I brought everyone in the health industry together, there will be some benefit in this cross exchange, sharing of knowledge, sharing of skills, where we don't have to be so protective about what we know. Knowledge should be universal. We can share. And this is the idea why even our logo looks like a house. It's not a housing society. If you look at our logo, there is a roof, and that is going to be under that roof are all the people related in health service under one roof.
I see.
So it doesn't matter whether you're a paramedic, you're a pharmacist, or whatever, as long as you deal in a component of the health service, you are most welcome to join this association.
Okay, Prof. Who should join MIHA?
I just answered your question. Anyone and everyone who is directly or even remotely associated with health and who is keen to share
Okay.
their ideas and learn from others, share their thoughtful ideas so others can learn from them. It's for mingling and sharing ideas and knowledge, of course.
So it's an open platform.
It's a very open platform to bring together people in healthcare because I think time has come for us to unite. The future of science is a very fast evolving material, and I think we need every help that we can get.
So everyone has a role to play.
Everyone has a
It's a
role.
role.
From the receptionist in the health service, who can be a great guidance because they can be helpful in doing the triage when somebody walks in. Somebody who needs to be seen urgently, somebody who can wait. Everybody has a role. So why not? So do educators.
Yeah.
So do nurses, ambulance drivers. You name it, everybody has a role.
Okay, so for more information about MIHA, you can directly to www.mihahealth.org or maybe can email them at info@mihahealth.org. So, Prof, for our final question, if there is one message you would like everyone watching today to remember, what will it be?
Come with an open heart. Come with a craving for knowledge. Come with a passion to share what you know with the others. Let's look at a real team building exercise from every discipline, from every types of healthcare service. And together, I think we can make it the best in the world.
Wow. So the future of healthcare is not about one profession working alone. And together we can shape the future of healthcare in Malaysia, be part of the change and be part of the solution and be part of MIHA. Is it correct?
That's right. Be part of MIHA. Let's be the future leaders or pathfinders to bring about this new concept where care is patient-centric and not meant to be practiced in isolation.
Yeah. Thank you so much, guys, for having us today, and thank you so much, Prof, for answering all my questions. Even though I feel like I'm in my medical school, even though I'm not related to any of that. Thank you so much. And for those who are watching this, don't forget to like, share, and subscribe our channel YouTube, Olympia Think Tank. See you. Bye bye.